Today we will discuss benzodiazepine withdrawal. But really quickly, are you fed up with lecturers using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Benzodiazepine withdrawal refers to the symptoms that can occur when someone who has been taking benzodiazepine medications, like Xanax, Valium, or Ativan, stops using them suddenly or reduces their dosage. These medications are often prescribed for anxiety, insomnia, or other conditions, but they can lead to dependence over time. In simple terms, what it is. If you've been using benzodiazepines regularly and then stop, your body might react negatively because it has gotten used to the drug. This is called withdrawal. Two common symptoms: anxiety or increased panic, insomnia or trouble sleeping, sweating or shaking, nausea or stomach issues, irritability or mood swings, difficulty concentrating, in severe cases, seizures. How to know if you have withdrawal. 1. Recent changes. If you've recently stopped taking your medication or cut back significantly after using it for a while. 2. Symptoms. If you experience any of the symptoms mentioned above, especially if they start a few days after stopping the medication, consult a professional. If you're unsure, speaking with a doctor or mental health professional can help assess your situation and provide guidance. If you or someone you know is experiencing these symptoms, it's important to seek help from a healthcare provider. They can offer a safe plan for tapering off the medication if necessary. If someone is experiencing benzodiazepine withdrawal, here are some simple steps to take. 1. Stay calm. Reassure the person that help is available. 2. Contact a doctor. Encourage them to speak to a healthcare professional as soon as possible. A doctor can provide guidance on how to manage withdrawal safely. 3. Avoid sudden changes. If they are still taking the medication, they should not stop abruptly without consulting a doctor. Gradually reducing the dose is often safer. 4. Supportive care. Keep them comfortable and offer a calm environment. Help them stay hydrated and eat light, healthy meals. 5. Monitor symptoms. Keep an eye on their symptoms. If things get severe, like seizures, seek emergency help immediately. 6. Encourage rest. Remind them to rest and take it easy during this time. 7. Seek support. Suggest talking to friends, family, or support groups for emotional support. Always prioritize professional medical advice for the best outcome. In a hospital, if someone is having a life-threatening benzodiazepine withdrawal episode, the medical team will typically take the following steps. 1. Assessment. They quickly check the person's vital signs, like heart rate and breathing, and ask about symptoms. 2. Medications. They may give medications to help manage withdrawal symptoms. This can include benzodiazepines. Sometimes they might give a controlled dose of a benzodiazepine to stabilize the patient. Other medications. They might use other medications to help with anxiety, seizures, or symptoms. 3. Monitoring. The person will be closely monitored in a safe environment. This might include being in a special unit where staff can keep an eye on them. 4. Hydration. They will ensure the person is hydrated, possibly through an IV if they can't drink. 5. Supportive care. Healthcare providers will provide emotional support and may involve a mental health professional. 6. Gradual tapering. Once stable, they will create a plan to slowly reduce the benzodiazepine dosage safely. 7. Follow-up. After stabilization, they will discuss further treatment options, including therapy or support groups. The goal is to keep the person safe, manage symptoms, and provide a path to recovery. Here are some specific medications commonly used to treat benzodiazepine withdrawal. 1. Diazepam, Valium, often used to ease withdrawal symptoms due to its long half-life, allowing for gradual tapering. 2. Lorazepam, Ativan, frequently used for its effectiveness in managing anxiety and withdrawal symptoms. 3. Chlordiazepoxide, Librium, another long-acting benzodiazepine that can help stabilize patients during withdrawal. 4. Clonazepam, Klonopin, sometimes used for its calming effects and to help with anxiety during withdrawal. 5. Phenobarbital. In some cases, this barbiturate may be used to manage severe withdrawal symptoms, particularly seizures. 6. Gabapentin. While not a benzodiazepine, it may be used to help with anxiety and other symptoms during withdrawal. These medications are typically administered under medical supervision to ensure safety and effectiveness. The choice of medication and dosage will depend on the individual's specific situation and needs. People at an increased risk of developing benzodiazepine withdrawal include 1. Long-term users. Those who have been taking benzodiazepines for a long time are more likely to experience withdrawal when they stop. 2. High-dosage users. Taking larger doses can lead to a higher risk of dependence and withdrawal symptoms. 3. Those who stop abruptly. People who suddenly stop taking the medication without tapering down are at greater risk. 4. Individuals with a history of substance abuse. Those who have struggled with addiction or substance use in the past may be more prone to withdrawal. 5. Older adults. Older individuals may be more sensitive to the effects of the medication and withdrawal. 6. People with certain health conditions. Those with anxiety disorders or other mental health issues may be more likely to depend on benzodiazepines and face withdrawal. 7. Inconsistent use. People who take the medication irregularly or skip doses may increase their risk of withdrawal symptoms. Recognizing these risk factors can help in managing the use of benzodiazepines more safely. Now you need to watch my video on strokes or have a look at heart attacks.